Hello, welcome to Drug Error Talk. I'm Matt Hamilton. Today we're talking about how death is caused by overdosing errors in anticoagulant drugs. My name is Matt Hamilton. I'm a drug error trial attorney. I represent the victims and their families. And I'm joined today by Dr. Jesse Garcia. Welcome, Dr. Garcia.
How are you doing, Matt?
Sir, what is your area of specialty?
Matt, I am a clinical pharmacist specializing in drug interactions and those effects on the human body.
Now, Dr. Garcia, our audience at home may remember an entire series of videos that we did on specific drugs and the type of dosing errors that can occur to harm people.
Correct.
And those are available on our YouTube channel and also on our website, worldwideweb.law-kc.com. Today, we're talking about a specific error, and that is there are people that die from these anticoagulant dosing errors. And what I want to know is, how do those deaths actually occur? I mean, what's happening in the human body that's causing it to die?
Okay, so the easiest way that I use to explain this is to think of the circulatory system as a pipe and a pump system. The pump being the heart, the arteries and veins being the pipe. Okay, so essentially what you have is you have the heart, which is pumping blood through a set of pipes. Okay, and the blood is designed, okay, to flow through those pipes. Now, at a very specific rate, the blood can cross into the tissue and move back, okay, bringing nutrients or supplying nutrients to very, very, very small areas. That's how you're able to get Tylenol or acetaminophen to be able to work on something where you stubbed your toe, because that chemical is being moved through the blood system all the way to the very tips of your toes.
Okay.
Okay, so that's the way to kind of begin that. The issues that can arise are going to come from two things. Either the blood leaving the pipe system. Okay, so you have a cut, and now the blood is now leaving. Okay,
It's going outside your body.
it's going outside of the body. Okay, external bleeding. Then we have internal bleeding. I said the drug is, or the blood is designed to stay in the pipe system. Okay, if it leaves the pipe system but doesn't leave the body, such as pooling in the stomach, you can have pooling in the pleural areas, spaces between the lungs and the chest wall.
That's how we get bruises.
Well, you get bruises because, yes, it'll get into the tissue and basically, when an injury occurs. Okay, so that's how you see your bruising. The deaths themselves can occur in terms of when you are leaving the body, or when the blood leaves the body. So say that grandma's walking down the stairs and she misses a step, falls, nicks her arm, she's on a blood thinner, and now she is literally bleeding externally. Okay, the blood is flowing outside of the body. Okay.
But it also can be internal bleeding.
Absolutely. Okay, same situation. She can have the same fall, and maybe she hits a chair, and externally there's no bleeding. You see a bruise, but internally there could be much more severe injury from that.
Dr. Garcia, is the actual death caused by this bleeding, is it the same cause whether it's external or internal bleeding? Is death caused the same way?
Death essentially is going to be caused the same way because you're looking at a system where the blood is not where it's supposed to be. Okay, so when that occurs, the body has a number of different ways to try to bring that blood volume. Okay, so we have about 5 liters of blood in the system, in the entire body, and so when you're losing volume out of that pipe system, the body will activate, like I said, number of different systems to try to maintain that volume. Okay, pressure is directly related to volume, and so if the volume goes down, in order to maintain the same pressure, the pump has to basically increase. Okay, so
your heart's beating faster.
The heart's beating faster, essentially. So you're trying to maintain that same pressure. You're losing blood either externally or internally into a place where it's not supposed to be. So the heart then has to speed up. Okay, so if this is an older patient who's already, prone to have heart problems, or maybe on blood pressure medications or other medications for the heart, now the heart's running into overdrive. Okay, so you could be seeing them as just flat out passing away or expiring from the loss of blood and not being able to maintain that. They might actually pass away from a heart attack because that heart's trying to keep up with the demands on the body.
So you've got an anticoagulant that causes the blood not to heal and stop, and so it's bleeding out either outside the body or inside the body. Now the heart and the cardiovascular system tries to overcome this by beating faster and shutting down non-essential systems to try to bring the blood volume back up.
Exactly.
And either the heart fails itself, so they die of a heart attack, or they just don't get enough oxygen to the brain and they die that way.
Correct. As the blood leaves, basically after you inhale, you're inhaling, oxygen. The first place that blood, once it gets into the system, okay, into the pipe system, goes to the brain. Obviously, you want the most oxygen in the brain at all times to keep you to be able to function. Okay, if you have lower levels of oxygen in your feet, obviously it's not going to be as detrimental for you as if it was in the brain. And so that's kind of the reason for that.
Okay. And so the death occurs either it gets so bad that the oxygen can't even get to the brain, or you overwhelm the system that's trying to get it there.
Exactly.
And they expire that way.
Then they expire that way. Or flat out, the blood volume is so severe, the blood volume loss, I should say, is so severe that the systems itself just can't, you just couldn't keep up. Even if it didn't, the heart's going to continue to beat and beat and beat. Same thing for you and myself. If we had an injury that was severe enough, we're not prone to heart problems, but if the injury was such that it was so bad, we would lose so much blood that, a normal functioning heart wouldn't be able to maintain the necessary volume and pressure to be able to keep oxygen and keep the blood flowing.
So in some systems, so much bleeding can occur that even though the heart continues to function, there's not enough blood there to do its job, and so they expire simply there's no oxygen getting to the brain, even though the heart's still beating.
Correct. And the heart will again try to beat faster, and it may keep up. You may never have per se a heart attack from it. The heart could have just kept going, trying to keep up, and you just simply had such a massive blood loss that you unfortunately passed away.
Because of lack of oxygen and other nutrients to where they need to go.
Correct, because you can no longer get oxygen to the brain, and once you start losing oxygen there, systems begin to shut down.
I see. Well, Dr. Garcia, it's been a pleasure learning about this. It's a terrible loss for people, and it's nice to understand what's going on.
That's the tough thing in these cases, is because you don't really kind of understand the background. We say that you've lost blood, the patient's bled out, but what does that actually mean? And so it's nice that we're able to share that.
For additional information, I direct you to our website, worldwideweb.law-kc.com. It's got a lot of material on it, written by physicians, that will assist you in your research. We've also done a series of YouTube videos. Go to our channel for those. That'll help you understand additional things. Dr. Garcia, it's been a pleasure speaking with you.
Absolutely, Matt.
This is Drug Era Talk. Thank you.